Also, let's go on to Professor Fox. How common are these nut allergies?
So nut allergies affect about 1 in 50 children. And many people will think, well, when I grew up, that it was really rare to be allergic to nuts, and it has become a lot more common. And certainly through the 2000s, we saw around a trebling of the number of people who suffer from nut allergies. So now most classrooms in any school, there'll be somebody with a nut or certainly a food allergy.
What's the best way of preventing them from happening?
There's a lot of exciting research over the last few years that suggests that if during early weaning of infants, the foods that you're at risk of becoming allergic to, so peanut, for example, are introduced without delay at all. So rather than putting off the introduction of them as weaning foods, including peanut butter, for example, sesame, egg, as weaning foods from as early as even 4 or 5 months, right, might reduce the risk of those allergies developing.
It's funny because my wife has a nut allergy, which is easier said than done because she obviously can't wean our son onto peanut butter, but that's what we've done. We've tried to, introduce it to him as early as possible.
This is all obviously thanks to the Natasha Trust while all this research is happening, isn't it?
Well, there are several really interesting studies going on, and Professor Adam Fox is referring to one of them that was done quite some years ago that produced results really that showed that if you early weaning of ordinarily allergenic foods, as you were describing, is beneficial. Natasha's foundation, the charity, the UK food charity, has been funding a £2.5 million clinical trial across 5 big hospitals in the United Kingdom to desensitise children and young people for their food allergies to peanuts and to cow's milk, which are probably the 2 worst allergens in the UK food system in society. And recently, there was some news that came out that was showing that although the trial isn't finished yet, and we really must wait for a trial to be finished to get a full, proper result, early indications show that children who are on the trial are really benefiting. And previously they couldn't eat any nuts or a fraction of a nut, and a matter of months later they're eating 6 peanuts a day. And that's without the use of any drugs or pharmaceuticals. It's actually using shop-bought foods to treat them, which is seems quite revolutionary, really.
Absolutely.
Yeah. Should add, it's really important that people don't try to do that themselves at home.
Yeah.
It's important that that's done under very careful medical supervision.
Can we just quickly go through the signs of someone who's going through when they're in shock?
Well, most reactions will thankfully be mild. So the typical signs will be very quick after eating the food, itchiness around the mouth, swelling, hives, things like that. But even an early sign of a more severe reaction, so that would be persistent coughing, any sort of difficulty in breathing, change in voice, or any suggestion that your blood pressure's dropping, so dizziness, confusion, those are signs of a more severe allergic reaction. And the most important things to do then are make sure somebody's calling for help. If there's adrenaline available, so an EpiPen or a Jext, get on and give it. It's a very safe drug. There's no reason to delay. And if you're not sure if it's bad enough, give it anyway and ask questions after. And if it's not better within 5 minutes, give the next one that you've got. And also lie the patient down as well. If they're uncomfortable because it's hard for them to breathe, they can sit up, but don't stand them up or try to walk them around.
Why is that?
Because that will make the blood pressure drop even further.
Right.
And it's been shown from a number of studies that if you stay lying flat, that's your best chance, and even raising the legs, of keeping the blood pressure up during that critical time.
Do you raise the legs?
So you can raise the legs, yeah, but make the patient comfortable, but really lying down and not moving them around.
Thank you.
Yeah.
Thank you.
Professor Fox, Lindsay and Nadine, thank you for joining us.